Erections during sleep, known scientifically as nocturnal penile tumescence, are a common physiological phenomenon experienced by men. Understanding this occurrence requires a look into various aspects, including biological mechanisms, hormonal influences, neurological factors, and the implications for male health. From a medical perspective, nocturnal erections are typically associated with rapid eye movement, REM, sleep, which is the sleep stage where dreaming occurs. During REM sleep, the body undergoes several physiological changes, including increased brain activity, elevated heart rate, and increased blood flow to various regions, including the genitals. This natural process is believed to be linked to the body's response to sexual dreams or stimuli, although many men may not recall dreaming about sexual content when they wake up. The physiological mechanism behind these erections involves a complex interplay of the nervous system and the vascular system. During REM sleep, the sympathetic nervous system, which usually inhibits erections during waking hours, is less active. Conversely, the parasympathetic nervous system, which facilitates erections, becomes more dominant. This shift allows for increased blood flow to the penis, leading to an erection. The process is intrinsically linked to the body's need for healthy blood circulation and is often considered a sign of normal erectile function. Furthermore, the role of hormones, particularly testosterone, cannot be understated in understanding nocturnal erections. Testosterone levels naturally fluctuate throughout the day and are typically highest in the morning. This peak in testosterone coincides with the REM cycles that often occur in the early morning hours. Therefore, the timing of nocturnal erections may be closely tied to the hormones levels, signifying its essential role in male sexual health. Erections during sleep serve several purposes beyond mere physiological responses. They can be an indicator of a man's overall erectile health and function. For medical professionals, the presence of nocturnal erections is often a positive sign, suggesting that the erectile tissues are functioning properly. If a man experiences erectile dysfunction during waking hours but still has nocturnal erections, it may indicate that the issue lies more in psychological factors rather than physical ones. Conversely, the absence of nocturnal erections can suggest potential underlying medical conditions affecting blood flow or nerve function, prompting further investigation. Nocturnal penile tumescence can also be influenced by various external factors. Stress, anxiety, and depression can impact sexual health and may lead to changes in sleep patterns and hormonal levels. Men experiencing high levels of stress may find that their nocturnal erections become less frequent, indicating a possible link between mental health and sexual function. Additionally, lifestyle factors such as diet, exercise, and substance use can play a significant role in erectile health. Smoking, excessive alcohol consumption, and sedentary lifestyles can negatively affect blood circulation and hormonal balance, further complicating the natural processes of nocturnal erections. Age is another crucial factor in the occurrence of nocturnal erections. As men age, physiological changes occur, including a natural decline in testosterone levels. This decrease can lead to reduced frequency and quality of nocturnal erections. However, it is important to note that while some decline is normal with aging, significant changes in erectile function should be addressed with a healthcare professional. Understanding the normal range of nocturnal erections can help men recognize when changes may indicate an underlying health issue. Medical professionals often utilize nocturnal penile tumescence testing as a diagnostic tool for erectile dysfunction. This test involves the use of a device that monitors erections during sleep, helping to determine if the erectile dysfunction is of a physical or psychological origin. By analyzing the frequency, duration, and rigidity of nocturnal erections, healthcare providers can make informed decisions regarding appropriate treatment options. Treatment options for erectile dysfunction can vary widely depending on the underlying causes. For men experiencing psychological factors, counseling or therapy may be beneficial. Cognitive behavioral techniques can help address anxiety and stress related to sexual performance. For those with physiological issues, lifestyle changes such as improved diet, increased physical activity, and smoking cessation can significantly enhance erectile function. In some cases, medications such as phosphodiesterase type 5 inhibitors may be prescribed to improve blood flow to the penis, facilitating erections. In addition to psychological and physiological factors, certain medical conditions can impact nocturnal erections. Diabetes, hypertension, and cardiovascular diseases are known to affect blood flow and nerve function, potentially leading to reduced nocturnal erections. Men with these conditions should work closely with their healthcare providers to manage their overall health and monitor any changes in erectile function. It is essential to approach the topic of nocturnal erections with an understanding of the normal physiological processes involved. Many men may feel embarrassed or concerned about their sexual health, but it is important to recognize that nocturnal erections are a natural part of male biology. Open dialogue with healthcare professionals can help demystify these experiences and provide reassurance regarding sexual health. Education about the normalcy of nocturnal erections can also play a vital role in reducing stigma surrounding male sexual health. By fostering conversations around this topic, men can feel more comfortable discussing their experiences, seeking help when needed, and exploring ways to enhance their overall sexual health. This understanding can lead to better health outcomes and improved quality of life. In conclusion, nocturnal erections are a normal and important aspect of male physiology. They are influenced by a variety of factors, including hormonal fluctuations, neurological activity, and overall health. Understanding the medical perspective on this phenomenon can help men recognize the significance of nocturnal erections in relation to their sexual health. By promoting open discussions and encouraging proactive health management, we can empower men to take charge of their sexual health and well-being. This knowledge not only fosters a better understanding of male biology but also encourages a healthier relationship with one's body and sexuality. Erections during sleep, often referred to as nocturnal penile tumescence, are a natural physiological phenomenon that occurs in males during the rapid eye movement, REM, stage of sleep. This occurrence can raise questions and curiosity about its biological, psychological, and social implications. When viewed through the lens of various religious perspectives, the topic becomes even more complex and nuanced. Different religions have diverse teachings and beliefs regarding sexuality, bodily functions, and the role of men in society, which can shape their views on nocturnal erections. In many religious traditions, the body is regarded as a temple, a vessel that houses the spirit. This perspective often leads to a dualistic view of the body and soul, where physical manifestations such as erections can be interpreted in various ways. Some religious teachings may see nocturnal erections as a natural part of human existence, while others may view them through a moral lens, questioning their implications on purity and self-control. In Christianity, the teachings about sexuality and bodily functions are derived from both the Old and New Testaments. The Bible addresses human sexuality in various contexts, often emphasizing the sanctity of the marriage relationship. From a Christian perspective, nocturnal erections may be understood as part of God's design for male anatomy, reflecting the natural workings of the body. However, discussions around lust and sexual thoughts could lead to a moral examination of the implications of such physiological responses. Christians are encouraged to cultivate purity of heart and mind, making the experience of nocturnal erections a potential point of introspection regarding one's thoughts and desires. Islam also has a rich discourse on human sexuality, emphasizing the importance of modesty, self-control, and the sacred nature of marital relations. In Islamic teachings, the body is regarded with respect, and bodily functions are seen as natural aspects of life. Nocturnal erections may be interpreted within this framework as a sign of healthy bodily function. However, the emphasis on modesty and controlling one's desires may lead to discussions about the thoughts that accompany such physical responses. Islamic scholars often encourage believers to seek knowledge and understanding of their bodies while maintaining a focus on spiritual growth and ethical behavior. Judaism offers another perspective on the topic of nocturnal erections. The Jewish tradition places significant importance on the body and its functions, recognizing that the physical and spiritual are intertwined. The Talmud and other texts discuss various aspects of sexuality and bodily functions, often emphasizing the sacredness of sexual relations within marriage. Nocturnal erections could be viewed as a normal physiological response, indicative of a man's health. However, Jewish teachings often encourage individuals to reflect on the desires and intentions, especially as they relate to purity and the sanctity of relationships. Many Eastern religions also have unique perspectives on the body and sexual functions. In Hinduism, for example, the body is often seen as a manifestation of the divine. Sexuality is not inherently viewed as negative but rather as a natural part of life that can lead to spiritual growth when approached with respect and understanding. Nocturnal erections might be perceived as part of the body's natural rhythms, possibly linked to concepts of energy and vitality. The emphasis on self-realization and understanding one's body can lead to a more accepting attitude toward these physiological occurrences. Buddhism, on the other hand, encourages practitioners to transcend attachment to the physical body and its desires. The teachings emphasize mindfulness and awareness of one's thoughts and actions. From a Buddhist perspective, nocturnal erections may be acknowledged as a natural bodily function, but practitioners are encouraged to observe such experiences without attachment or aversion. The focus is on cultivating a deeper understanding of the mind and body, recognizing that physical sensations are transient and do not define one's true self. In various indigenous and cultural spiritualities, the understanding of the body and its functions can vary widely. Some traditions may view bodily functions as sacred expressions of life, while others may hold more restrictive views regarding sexuality. In these contexts, nocturnal erections could be interpreted through the lens of cultural beliefs about masculinity, fertility, and the connection between physical health and spiritual well-being. The diversity of perspectives within indigenous and cultural traditions highlights the importance of understanding the broader context of beliefs and practices surrounding the body. The intersection of religion and sexuality can lead to complex discussions about morality, purity, and the human experience. Nocturnal erections, while a natural physiological occurrence, can evoke a range of responses based on individual beliefs and cultural contexts. Conversations about this topic often reveal the underlying values and teachings within a religious framework, shaping how individuals understand their bodies and the desires. In many religious communities, discussions about bodily functions and sexuality can be fraught with tension. On one hand, there is a desire to understand and accept the natural workings of the body, while on the other hand, there may be apprehension about the moral implications of such experiences. This tension can lead to stigmatization or shame surrounding natural bodily functions, which can ultimately hinder individuals from embracing their humanity fully. Furthermore, the modern discourse surrounding sexuality and the body is evolving, influenced by advancements in science, psychology, and social awareness. As societal attitudes shift, many religious communities are beginning to engage more openly with topics such as sexual health and bodily autonomy. This evolving dialogue encourages individuals to explore their beliefs about the body and sexuality in a more nuanced and informed manner. The conversation about nocturnal erections also intersects with broader discussions about mental health and well-being. For many individuals, the experience of nocturnal erections can evoke feelings of confusion or anxiety, especially in the context of religious beliefs that may emphasize purity and self-control. It's essential to approach these discussions with empathy and understanding, recognizing that individuals may grapple with their experiences in various ways. Ultimately, the exploration of nocturnal erections through religious perspectives invites individuals to reflect on their beliefs about the body, sexuality, and spirituality. It encourages open dialogue about natural physiological responses while fostering an environment of understanding and acceptance. By engaging with these topics thoughtfully, individuals can cultivate a deeper awareness of themselves and their beliefs, leading to a more profound sense of connection with their bodies and their spirituality. As society continues to evolve, the importance of fostering respectful conversations around topics such as nocturnal erections cannot be overstated. Encouraging open dialogue within religious communities can help dispel myths, reduce stigma, and promote healthy understandings of sexuality and the body. This, in turn, can lead to greater acceptance of natural bodily functions and a more holistic understanding of the human experience. In conclusion, nocturnal erections serve as a fascinating point of intersection between biology, psychology, and spirituality. When viewed through the lens of various religious perspectives, this natural phenomenon can evoke a range of responses, from acceptance to moral questioning. By engaging in thoughtful conversations about the body and sexuality, individuals can foster a deeper understanding of themselves and their beliefs, ultimately leading to a more compassionate and accepting attitude toward the complexities of the human experience.